Yeah. Hello, everyone. Welcome to a very important topic today. It's gait, and I take the pleasure of introducing Dr. Siddhart Yadav sir today. So he's a senior consultant orthopedic at Apollo Hospitals, Navi Mumbai, and he is a master's in orthopedics. He has done his fellowship of ASIF, FASIF from Australia, and he's also a fellow in arthroplasty from USA and Germany. His interests include arthroplasty, complex arthroplasty, revision knees, revision hips, and trauma. So without any delay, I will hand over the proceedings to Siddhart Yadav sir, and we'll start this webinar.
Thank you, Agnivesh, and thank you for giving me this opportunity. So gait as such is very complex topic, and it is itself a subject. So in an ambulatory patient, orthopedic ambulatory patient, clinical examination is incomplete without gait inspection. And without knowledge of gait, this picture which I have displayed, it may be a fun-loving cartoon, but once you study gait, basic gait, these are the very basic important steps of gait. This definition, exam point of view, you should know. Gait is defined as forward propulsion of the body by lower limbs in a systemic coordinated semi-rotatory movements of trunk, arms, and head. Now the function of gait, this is important to know. First function is to support head, arm, trunk by maintaining a semi-rigid lower limb, to maintain upright posture and balance, that is to maintain center of gravity, and to control foot to clear obstacles and enable gentle heel and toe landing through eccentric muscle action. Also to generate mechanical energy by concentric muscle contraction, and to maintain an increased forward velocity if needed, which is called acceleration. Also through eccentric action of muscles, it provides shock absorption and stability and decreases forward velocity when it is required, which is called deceleration. So function of gait is to support, to maintain center of gravity, to control foot, to generate mechanical energy, that is acceleration, and shock absorption and deceleration. Now 4 essentials are important for a normal gait. Skeletal integrity, then the muscular control, equilibrium, and neurological control. Now understanding gait, one must know the temporal or spatial variables. What is gait cycle? What are the gait kinematics? What is center of gravity? What are the normal gaits and abnormal gaits? Hello.
Yes, sir, you are audible.
Can you hear me? Yeah. Now distance variable will start with base of support. What is base of support? Base of support is basically horizontal distance between both the feet, and it provides balance and stability. Normally the base of support is 2 to 4 inches. Now base of support can be increased or decreased in physiological condition. When child is small, to balance, they increase their base of support. And when we more stability, like lifting heavy weight, or when we are at an uneven place, we increase our base. It can be decreased, for example, in a catwalk, they try to narrow it down. Second is the step length. It is the linear distance between both feet traveled during one gait cycle, between left and right. It is approximately 15 inches. Now, what is the stride length? Stride length is the linear distance of progression of one foot during one gait cycle, means between left to left foot or right to right foot. Approximately is 27 to 32 inches. Now, clinically, these are important when we later on will see what is abnormal gait and what is normal gait. These variable step length and stride, they change. Now, toe out angle, normal foot progression angle also it's called. It is the angle of foot makes with path of the subject walking. It is 10 to 15 degree external rotation. Normally in an abnormal gait, later on we'll see whether in-toeing or ex-toeing, in-toeing and out-toeing gaits, this become abnormal. Now, what are the temporal or time variables? These are cadence, speed, single limb support and double limb support. Now, what is cadence? Cadence is number of steps per minute and approximately it is 70 steps per minute. Now, what is the speed? The walking speed is distance covered by body in a unit time. It is measured meter per minute. Average velocity step length is it is multiplied into cadence. So average speed walking speed in a healthy person is around 80 per minute. This is important. Now gait cycle. Now gait cycle is period from one heel strike to the next heel strike of same limb. This is called gait cycle. There are two phases of gait cycle. One is stance phase, which is 60% when foot is in contact with the ground. And the main task is weight acceptance and single limb support. The second phase is swing phase, which is 40%. In that, foot is in the air and the task is limb advancement. Now the stance phase, which is 60%, has 5 parts. First, initial contact or heel strike, then there's a loading response or foot flat, then there's a mid stance, and then terminal stance and toe off or pre-swing. Swing phase, which is 40%, it has initial swing, mid swing and terminal swing. It has 3 parts. Now, what is single and double limb support? Single limb support is amount of time spent during one gait cycle when single limb supported whole body weight. Double limb support is amount of time spent when both feet support weight bearing and during a gait cycle. Now single limb support, it decreases when walking and it affects walking velocity. For example, single limb support is decreased when there is a painful condition and that stance phase is reduced, which is we see in ANTALGIC gait. Double limb support increased when person walks slow, like elderly patient in a balance disorder or increase walking velocity. Now, what is the difference between walking and running? As gait speed increases, double limb support decreases. And during running, the double limb support phase disappears and which is replaced by double limbs float, or we also call double float. When both the legs they are in air, this is called double float. We also must know what is gait kinematics. So it is basically study of joint motion during gait cycle in 3 planes: sagittal plane, coronal plane, axial plane. So in sagittal plane, the movement which happens is anterior posterior pelvic tilt, which is 5 degree, knee flexion extension, hip flexion and minimal extension, dorsiflexion and plantar flexion of ankle. In coronal plane, there is hip joint minimal adduction and also there is minimal abduction for ground clearance. In axial plane, there is a rotation of pelvis, hips rotate minimally. Tibia also rotate externally, but very minimal. Gait cycle is further divided following. First is the cycle, that is, for example, this is right leg cycle. Then there are 2 phases, stance phase, swing phase. And the purpose, as per the purpose task, they are divided in weight acceptance, single limb support, limb advancement, and there's a period. Period means load response, mid stance, terminal stance, pre-swing, initial swing, mid swing, and terminal swing. And following period, there's an event. Event which happens is initial contact, load response, heel off, opposite initial contact, toe off, feet adjustment, tibial vertical, and next initial contact. So what are the function of these periods? When the initial limb is supported, double limb supported, which is around 12%, there's a loading and weight transfer, the main function. Single limb support, does it support entire body weight and mass move forward. During the second double limb support, there is unloading and preparation for swing. An initial swing, which is between 60 to 75% is foot clearance. In mid swing, the limb advances in front of body. And there is a terminal swing with a limb deceleration, preparation for the weight transfer. Now, what are the joint position during the gait cycle? This is important because once you know, then in abnormal gait, you can find the pathology. For example, when heel strike, the hip is in 30-degree flexion, knee is almost in extension, and ankle is neutral. During the loading response, the hip is getting now in extension, knee is 15-degree flexion, and foot in 15-degree plantar flexion. In mid stance, there is extension, the hip is neutral, knee is neutral, and ankle is in minor 10-degree of dorsiflexion. In terminal stance, the 10-degree of hyperextension, knee is in full extension, the neutral ankle or minor movement in the ankle. Now in pre-swing, again the hip is in extension, knee is going in 30-degree, 35-degree flexion, and ankle is 20-degree flexion. During the initial swing and mid-swing, hip is getting back to in flexion, and knee is going into further flexion, and ankle remains neutral. And during the terminal swing, again the hip is in flexion. So in the swing phase, main movement is at the hip and the knee, and there is hardly any movement at the ankle joint. Now, role of muscles during these activities. For example, when heel strike, the main muscle, the purpose is for the shock absorbers. And the muscles which are active in heel strike are quadriceps and dorsiflexor of the ankle. In stance phase, which is basically the muscle function is to stabilize gluteus maximus, medius, minimus, tensor fasciae lata, erector spine. During initial swing, FDL, FHL, gastrosolius, longus brevis, and tibialis posterior. And the main activity is to foot lift off. So you should know during the gait cycle, which are the main muscles active and what is the purpose of that muscle activity. Now, during initial contact, the adductor longus magnus and iliopsoas sartorius, they are active, and the activity is accelerator, muscle accelerator. During swing phase, EDL, FHL, tibialis anterior, they are active, and they're controlling the foot, is the foot controllers. Mid swing to initial swing, gracialis, semimembranous, semitendinosus, biceps femoris, they are active, and they are decelerators. Now, what is center of gravity? Center of gravity in a human body is an imaginary point which lies 2 inches to the S2 vertebra. Now, during the gait, the center of gravity, it follows vertical displacement and horizontal displacement. Now, it is important to maintain the center of gravity with minimal displacement. In a normal person, the vertical displacement happens in a rhythmic way. The highest point of the center of gravity is mid-stance, around 5 centimeter. And in horizontal displacement, there is a lateral limit in mid-stance. Average displacement is 5 centimeter. So in a normal person, the center of gravity moves up and down vertically and horizontally 5 centimeter. And when we see from behind, it's a figure of 8 displacement. And these displacement, they require energy. So idea is minimal, there should be minimal displacement of center of gravity. So there is a maximum energy to utilize minimal energy. Or in gait cycle, we also say center of gravity and energy consumption. For example, in a dance where there is a greater displacement of center of gravity, which require maximum energy, and you cannot do dance for a long time, you'll get tired. So in a regular walk, you can walk for hours because there is a minimal displacement of center of gravity. So greater the displacement center of gravity, the more energy is required. Ideal gait is with minimal displacement center of gravity and to give you best or maximum mileage. These are also all the runners, all the marathon runners, all these things are important. What is their style of running? What is their style of walking? That's how they can run for long. Now, gait observation. Once you know what all about gait, now we have to observe gait. We have to observe from front. when we observe from front, you have to see whether the patient is assisted or unaided, phase of the gait, whether they are equal phase or unequal phase. We have to see the rhythm and balance, position of the head, position of the shoulder, arm swing, pelvic tilt, any pelvic dipping is there, knee and foot stability. Then you must see from the side, anterior and posterior trunk bending, increased lumbar lordosis, steppage, excessive knee flexion, extension, faulting, insufficiency, any push-up or dorsiflexion control. Now from behind also you must see the front, how the hip is, how the hip circumduction is, abnormal foot contact, hip rotation, pelvic dipping, and also the walking base that you can see also from front. Now what examiner want to hear from the gait description, how you have to describe the gait is, patient is walking unaided with equal stance and swing phase with normal base and rhythmic arm swing. Head is positioned in the center of the shoulder with no pelvic dipping. Knee and foot, they are stable during stance phase. This is the way you should explain to the examiner, and this is what they want to hear from you in a normal gait. Now, what are the normal variation of gait? Athletic gait. At the end of game, what happened? The players, they have a crouching attitude. They lean forward to keep the center of gravity as low as possible, and that prevents fatigue and give them more space. This is called athletic gaits. Second is the mourner gaits. In mourner gait, what happened in any morning ceremony, people of various height, they are present, but crowd, it moves at same pace by altering their cadence. However, this alteration cannot be sustained for a long time, and the tall person will take a step forward and then bring it back a bit. In such case, the energy expenditure is more. So mourner gait is, he take a bigger step and then pulls it back. It's called mourner gait. Now we'll discuss about abnormal gait, which is important for orthopedic point of view. Anything which causes abnormality in abductor mechanism, joint pathology, any muscle weakness, or any neurological involvement give abnormal gait. There are various abnormal orthopedic and neurological gait, and I have mentioned some of them, and we'll discuss about few of them because we should know few of the neurological gait because that's an entire different subject. Now this is most common and commonly asked for. First is, everybody must be knowing what is antalgic gait. In antalgic gait, the stance phase of the affected side is shortened due to pain in weight bearing limb. So increase in stance phase on affected side. See how the video, the person antalgic gait due to the pain, he's on the affected side, his stance phase time is reduced, and which is seen in any painful condition of the lower limb. So antalgic gait is the common. Second is, what is Trendelenburg gait? Now, as you must be knowing what is Trendelenburg sign. Any condition which disrupts abductor, lever arm of femur by weak powers of abductors, or defect in fulcrum, that is bone, or makes ineffective hip stabilization in stance phase. So what will happen? The opposite side of the pelvic dips like this. So clinically, when a person walks, the opposite side of the pelvis dips. This is called Trendelenburg gait or gluteus medius gait. Now, what is duck waddling gait? This is called, or also known as bilateral Trendelenburg gait. It is just when the Trendelenburg gait happens on the both side. So it means both side of abductor mechanism, they are involved in poliomyelitis, muscular dystrophies, motor neuron disease, or defective fulcrum like bilateral CDH, pathological dislocation of hip, or there is a bilateral fracture of the neck femur, old or Perthes disease, or Coxa-Vara. This is how the person walks in waddling gait. Now, what is ALDERMAN'S gait? This is seen in TB dorsal lumbar spine. And what happens in ALDERMAN'S gait? The patient walks with head and chest thrown backward and protuberant abdomen and legs thrown wide apart. So with wide base, the person walks with head and chest thrown backward and abdomen is protuberant. The second is the short limb gait. Now the shortening less than 1.5 centimeter is compensated by pelvic tilt, and shortening up to 5 centimeter, that is compensated by equinus. Now it is more than 5 centimeter, then the short limb gait is observable. The patient dips his entire body on that side. It is short limb gait. Now what is high stepping gait? This is seen in foot drop. On heel strike, the toe drops on the ground first, and to avoid this, the patient flexes the hip and knee extensively and rise the foot and slap it again back. This is called high stepping gait or foot drop gait. Now, what is quadriceps gait? This is seen in most commonly in poliomyelitis. Now, because knee is locked by quadriceps contraction and transmitted weight during the mid stance. Now, in case of weak quadriceps, the knee is stabilized by leaning forward. The patient lean forward and press over the lower thigh by his ipsilateral hand. This is also known as hand to knee gait. Now, what is gluteus maximus gait? This is also called or rocking horse gait. In this gait, due to weakness of gluteus maximus, there is a weakness of hip. There is a weakness of hip extension. So how to compensate that, to compensate that, in mid stance, the trunk is lurched posterior to extend the hip, and it is seen in poliomyelitis, also in above knee amputation with prosthesis. Now, what is stiff hip gait? When hip is ankylosed and restricted flexion, so person cannot clear the ground in swing phase, which is compensated by lifting pelvis on the same side. GENU recurvatum gait or hyperextension gait. In paralysis of hamstring muscle, the knee goes into hyperextension while transmitting the weight in the mid-stance phase. It is seen in poliomyelitis. Stiff knee gait, there is no flexion at knee, so the elevation of pelvic on the same side with circumduction of hip to achieve the ground clearance. Now this is intoeing or outtoeing gait. Intoeing is seen in femoral anteversion excessive or tibial intorsion. The patella, they are called kissing patella. They are directed inwards, and it causes excessive outtoeing is called in opposite direction. That is also known as Charlie Chaplin-like gait, and that is also called, and this is also by abnormal tibial torsion. So intoeing and extoeing, intoeing and outtoeing gait. Now, what are the neuralgic? There are various neurological gait, but you should know about what is stamping or ATAXIC gait. There is loss of sense of balance, and patient sways in different direction whenever in one place, called titubation. Means patient moves when in stance phase, front, forward, and side to side, and also generally sways toward the stance phase during ambulation. What is stamping gait? It is seen in peripheral neuritis, brainstem lesion in children, and tabes dorsalis in adult. Scissoring gait is common in cerebral palsy, and the person walks by crossing legs to each other. This is important. FESTINANT gait, or what is Parkinson gait? Now, patient with Parkinson, they take short step, and they barely clears the ground, very short step, very little step, with flexed neck, trunk, hips, and knees. Hemiplegic gait is also, it is in upper motor lesion, there is rigidity in the lower limb. So person walks with extension at the knee and plantar flexion at ankle. And also there is extension at the hip. So circumduction of limb at hip while swinging the limb to achieve forward propulsion. So he makes semicircle every time when walks. Now, Gait as such now has become very advanced, and as I told you, it's a separate subject. There's a gait laboratory where which is when you mention short note on gait, you can write about it. In 1957, it's first started for polio and CP, and now they are very advanced. They are useful in pre-operative planning and outcome evaluation of orthopedic and neurological condition. They are very important in early diagnosis of many neurological disorders, especially Parkinson's. And for example, the patient recently I've seen, she was not able to walk after bilateral TKR done elsewhere. And once I made her walk, I realized she's early Parkinson's. And later on, she was sent to neurologist, and after treatment, she became all right. Now, the take-home message is you should know the gait definition, because you have to again see this presentation 2-3 times. It's as such quite boring. Also about gait cycles component, various terms used in gait analysis, what are the muscles involved in different gait cycles, and some of the orthopedic abnormal gait, and also some of the few neurological gait. Now, I'll ask you a couple of questions for your self-assessment, and you can write down yourself. Now, in this picture, the image 2 and image 5, what are the phases of gait? What is the what you label these 2 and 3 in this for the gait cycle? You're done. Next is, what is this gait known as? Person leaning backward, hip is in front, and third is, what are the question mark? The long and the big one, long arrow and the small arrow. And fourth is, what is double foot meaning? And fifth is, what are the anti-gravity muscles? So anyone present in the class can answer this. What are the anti-gravity muscles? Anybody is? Rahul is there. Shreyans?
Gluteus maximus, sir.
No, there are many muscles, anti-gravity muscles. Gluteus maximus is one of them. Any other?
So Rahul, think at joint level. Think at knee, which is the anti-gravity muscle for knee.
Okay, you start from erector spinae, then you go abdominals, then gluteus maximus. Then at knee level, what will be there? Quadriceps. And what will be there below knee? Gastrocnemius and tibialis anterior. These are the anti-gravity muscles. Okay, what is double float? Anyone can tell me? What is double float meaning the gait? Okay, when person start running, both the feet they are in the air. This is called double float. Now this you should tell me. What is the big first arrow here and this two? What is the meaning of this? How you label it?
So, bigger one is step length and smaller one is base of support.
This is base of support. The down one is step and this is stride. Okay. Anyone can label this? What is this 2 number? This cartoon is, what is the stage of this gait here?
Flat foot or mid stance.
Correct. And what is this third one? Initial, it is the starting of swing phase. The hint I can give you. Starting of swing phase.
So this, in this third picture, you can see that 2 feet are doing 2 different things. So they are almost simultaneously doing, so left leg is doing something else, right is doing something else.
So here is a heel touch. And this is?
Toe off.
Toe off, yes.
Toe off, correct. Okay. And so we have done, what is this now? Okay, this is interest. This gait is, I have explained.
Extension lurch gait.
Yeah, there is a person is maintaining extension at the
Gluteus maximus gait.
Yeah, this is gluteus maximus gait, correct.
Walking like a lord.
Yes. This is Rahul. You have, who has answered this? The long one and short one.
Nihal answered.
Nihal answered. Okay, good.
First prize.
Double float. Anti-gravity muscle. So okay, so now if somebody has scored is 0 to 2, they have to see this presentation again, because this is in first time you will not understand. It's very boring as an orthopedic, but some basic for theory it comes a short question, and in exam practical examiner asks 1 or 2 questions regarding gait. If you have 3 out of 5, you are very good. If you are 4, you are very excellent. And fifth answer, if you can give all 5, because I didn't tell you anti-gravity muscle in my talk. So you are an expert.